Thank you again for joining us tonight. My name is Barry Erickson, and I'm Community Engagement Coordinator here at Wheaton Public Library. As we face a new year and a new semester, we are proud to host this program on anxiety and depression in children. Dr. Nida Hossein is a clinical and health psychologist with 10 years of experience. She works with kids as young as 4 through adulthood, specializing in anxiety, depression, adjustment concerns, and coping with difficult health diagnoses. Thank you again for being with us tonight, Dr. Hussein.
So thank you for taking the time out today and attending this. I know it's really important, just given what's been going on in the last 2 to 3 years. I think it's fair to say that we've all been overwhelmed, right? With the pandemic, it kind of threw us off for a loop. And we've noticed that there's a lot of changes happening, particularly in childhood anxiety and depression, with rates increasing. So I just wanted to give this presentation to give you a better idea of what you can look for in children and how you can help them. So what we're going to start out with, I found this video and I find it very helpful to kind of get a basis of what we're seeing, but keep in mind that the newer rates for anxiety and depression are not completely out there post-pandemic. They're still doing a lot of research. So we do know that it's a lot more heightened, but we just don't know the exact rates as of now.
Why not an A?
Let's go.
I really need to be more
Show me your
responsible.
test.
Clean your room.
Let's go.
Why is it a B?
What are you doing?
What
is
wrong with you?
Everything is like coming on you at once, and you're trying to deal with it, and you can't.
Nervous or something, and sometimes stressed out about something.
Everyone expects me to be the best, and that's really hard to do.
I'm kind of worried and a little scared sometimes.
Help when I'm anxious, like I can't deal with everything on my own.
I feel scared and I feel like crying.
I usually tend to be annoyed easily. I get irritated easily and I can't sit still.
Sometimes I really get so worried that I'm worried I can't really do it, and I think about if I can't do it or not.
I'm sad. I start to cry. Like, I just get really worried. I can't do anything.
And this was just a glimpse of kind of what we see both clinically and what we hear from parents. And it just depicts on how much it affects the child. And sometimes they don't even realize how much it affects them until much later in life. And so what I really want to try to outline for you all today is understanding how this comes about from not only a biological standpoint, but from a social standpoint as well as developmental as well. So when we say biopsychosocial, we mean biology, psychology, and the social aspects of it. I want to give you some tools that you can look for early on just to kind of help them with protective factors. I do want to go over some of the symptoms and presentation clinically, and then what you're actually seeing at home, as well as giving you some tools of what you can do at home before you may come and see a therapist or a psychologist. So as parents, it can be really hard to decipher which emotions actually need attention. But for children, it can be even harder because they don't always have the language or the words to describe what they're feeling. They just know that it's uncomfortable, but they don't know entirely what they're feeling. And so what I always like to say is that anxiety and sadness, although uncomfortable, is not a bad thing, right? It's part of our day-to-day functioning, and we need these feelings in order to kind of grow. And so just because a child may be sad or feel a little anxious, it doesn't mean that's red flags all of a sudden that there's something negative happening for them. They should be experiencing all the emotions. So why is this a concern, right? Why is it that we're starting to see that the mental health issues are peaking from 13 to 20? Now we know that at this age, 13 to 20 is one of the most vulnerable groups that we're seeing mental health issues in when you compare it across all ages, aside from 80-year-olds. So we do see in the 80s, this kind of picks up again. But other than that, it's one of the highest groups. And a similar intensity is reported in 80-year-olds just because they're coming to an end of life procedure, whereas 30 to 20-year-olds are coming to where do I fit in? And so just because we're starting to see, not starting to see it, you actually will see full blown between the ages of 13 to 20, but it actually will start in smaller amounts between the ages of 10 to 19, which is your adolescent period. 1 in 4 will experience some kind of mental illness in their lifetime, and this is across all age spans, but for children, it's 1 in 5. And it's been, like I said earlier, drastically increased since COVID. Anxiety is actually the most common form of mental stress for children, followed by depression. And suicide in general is the third leading cause of death from ages 15 to 24, and the second for age group 10 to 34. So when we're looking at the brain, just kind of some background information is that every brain will develop from the bottom up. And the way I used to remember this in school is like the OTP theory, right? So it's the occipital, it's the temporal, and then it's the parietal. And basically what's happening is that these basic functions need to form before the frontal lobes can develop. And so the frontal lobe is our executive functioning, it's our planning, it's judging, it's thinking things through, which if you guys have teenagers and kids, you know that sometimes, well, not sometimes, a lot of times that is a struggle. And it's because our brains are not actually fully developed until the age of 25. So it's very interesting how laws and things are made because an individual isn't actually acting in accordance to being an adult from their brain until they're actually 25 years old. And so what happens is because the frontal lobe is so much more complex, it needs to build on those. They're not like simpler in terms of like, they're not, when I say this, it sounds a little bit confusing. So they're just easier to develop and they're the basic foundation. So it needs that foundation in order to build the more complex connections. Now, when we're actually looking at the adolescent brain, there's 3 main chemicals that are being changed at this time. And so the first one is glutamate. So basically what's happening at this page, this is the chemical that will keep us entertained, right? So this explains why as a baby, I can probably do peekaboo, right? And the child would be excited. If I do peekaboo to you guys, you might think I'm a bit strange. And so what's happening at this point in time, and again, the adolescent period is about from 10 to 19, is that glutamate is starting to decrease. And so this is when you'll start to hear, I'm bored, right? It's a very typical thing. Parents complain about it all the time. The kids in sessions will complain about it, but being bored is not a bad thing. It's just because of those chemicals decreasing that they're experiencing a little bit more intense than they did in the past. The second transmitter that we're dealing with is dopamine, right? And this is the feel good one. This is the one that a lot of us know about. So when we exercise or do things that are pleasurable, we get a hit of dopamine. What's happening in an adolescent brain is that there is more dopamine that's being released. So if you kind of think about 2 cups, right? And 1 cup represents the adult brain, 1 cup represents the adolescent brain. What's happening is that, say both cups are full with dopamine. When I do an enjoyable activity, let's say both of us enjoy roller coasters, and we both go on a roller coaster, the adult and the child. About 40% of my dopamine may be released, whereas 90% is released for them. So they're getting this hit, this rush, right? They feel really good and they want more and more of it, right? And so because a lot of the time, what gives them that rush is risk-taking behaviors and things that can give them the maximum amount of results, which are typically not the healthiest forms. They're trying to do that a little bit more because they do have that hit happening a lot quicker and a lot more intensity. The third one is the serotonin, and this is what controls our mood and our behavior. So when we have less levels, we're more sensitive to changes. When we have higher levels, then we're kind of more at a baseline. And so what you'll see a lot of times is this roller coaster effect, because what's happening is that it's trying to figure out, look, how much is enough? How much do we really need? This is where you see a lot of mood swings happening. And then they're seen as more emotional and reactive to stress, and cortisol is now being released, not for the first time, but it's being released more just because when the serotonin starts to dip, cortisol will dip in and it starts to increase and take more of a front stage. So that's when they'll start to experience some anxiety and feeling like, oh my God, like I just can't handle it feeling. There's a striatum theory, which basically is a theory, if you want to think about your thyroid, right? There's a hypoactive and a hyperactive. What they found when they did imaging in adolescent brains is that there's a lot of action happening in the reward center of their brain. And so it's very hyperactive. So when you have a hyperactive thyroid, you metabolize things a lot faster, right? So you may be hungrier, thirstier. And so they constantly, they're in need of this reward. What can I get out of it? They're looking for situations that they'll get something out of. And so their judgment is basically off of things that will give them the biggest rush and the here and now. They're not necessarily focusing on long-term plans. They're just kind of like, here now, I want this. This is what I need. Now, when we go into a little bit more of the developmental stages, which some of you may be familiar in, because a lot of times you take this in your psychology courses, even in undergrad or even in school and high school. And so there was a psychologist named Erik Erikson that kind of summed up what's happening from a social standpoint, also taking in mind what's happening neurologically. So what we're seeing here is that from birth, you have this need, so 0 to 18 months, is this need to form trust in your environment, right? If I don't feel safe, I interact very differently with my world. And so the goal at this point in our lives is really to say, can I trust the people who I have been given to, right? Can I trust my parents, the people around me? Is the world a safe place to interact? By 2 to 3 years, it's called autonomy versus shame and doubt. And basically what they're trying to understand is, can I be my own person, right? Or do I always need to rely on other people? So a lot of times, sometimes, they'll say, oh, you're not old enough to do this. Saying that too much can actually hinder their development because they're actually wanting to do things on their own. Between 3 and 5 is a stage of initiative versus guilt, which essentially means, am I a good person or a bad person, right? As they venture out into the world, they start to realize that they don't necessarily need parents. What can they do without their parents, right? And so a perfect example of this is a lot of times kids want to hold their parents' hands, right? At preschool, they want the parent to hold their hand up until the door. Now, at some point, they don't want that anymore, and they start to venture out, is that okay? And parents will, of course, not with malintent or anything like that, will say, oh, like if the kid leaves the hand and doesn't want to hold it all the way up until the door, they'll be like, oh, you don't love mommy anymore, you don't love daddy anymore. And the kid internalizes this as basically meaning that me letting go of my parents' hand means I'm not a good person. And so what we want to do is kind of encourage them to take that initiative. And then you have the school age children, right, between the age of 6 to 11. And this is a period of industry versus inferiority, right? This is when they start to recognize their strengths, their weaknesses, and they want to be good at something. And so they really need to feel confident about some area of their life. So it's really good to kind of get them into activities that they're good at. During the adolescent period, you have this period called identity versus role confusion. And this is when they're just trying to figure out who they are and where they fit in, essentially. I'm not going to really go into the other phases because it's not pertinent to what we're talking about, but it is here in the slides just to kind of give you a full gamut that he does start from 0 and then goes all the way to adulthood. So now we're looking at the time of adolescent where we called identity versus role confusion. And what we're noticing here, sorry, just had a little mishap in my notes. Okay, so adolescence is really a period of time where you're moving away from your parents, right? And so it's more about social media, friends, and even maybe some like aunts and uncles and older people who are not the core caregivers, essentially. So it could even be a school counselor, it could be a therapist, it could be anyone pretty much who are not their parents. And so what's happening at this period is that they're just trying to navigate the world of where do they fit in, and who do they want to be. So at this time, you're going to see a lot more risk-taking behavior where they think that they're untouchable because, again, that frontal cortex hasn't developed yet. And so there is kind of this excessive need of being impulsive. It becomes harder to say no because they want to fit in. And a lot of times it's the first time they may be experiencing romantic feelings. So there's a lot of things happening all at once that they feel like they need to know the answers to right away. And so it's really a time that they're confused and they're looking to have a role model. But again, unfortunately, it's not mom and dad. I wish it were. Like, mom and dad come in later in life a little bit, but it usually is somebody that is close to the family or close to them, or who they view as being part of the in circle. And then a lot of times what you can see at this point is that parents will often describe their kids as being very emotional, and it seems very intense, and it almost feels dramatic, but that's only because, again, what's happening is the frontal cortex isn't fully developed. So what they're experiencing feels like an emergency, but as adults, we know that it isn't an emergency, but it actually feels like that to them. They're not making it up. Now we're going to kind of put this all together, and I'm going to give you some tips in terms of how to support just general growth of a child. So at year one, we're really looking at copycatting, right? They're known as the impersonator. So what you're probably seeing is that, you know, your son or daughter might be picking up a cell phone when you're on the phone, and they're talking into it, and they're doing a lot of the behaviors essentially that you're doing. And so while babies will imitate from birth, this is the first time that it's happening with intent, right? Because your frontal and the parietal lobes are starting to develop at this point, and there's an increase in language and social skills. And so they just want to like copy everything, but they're doing it with intent. It's not just kind of they're doing it and they don't have any idea what's going on. It's actually more meaningful, and it's pretty much entertaining the idea of pretend play later in life. Now, how can you help a child at this phase? Like, I know a lot of times that there's a lot of background information, especially since COVID, that the TV tends to be on, right? And so what they've found is that by having the TV on, it actually distracts the child from having this time to copycat. And so I'm not saying all the time. Sometimes, yes, of course, watch your TV, enjoy, but try to make time where you shut off the TV and just do you, whether it's reading a book, it's talking to your spouse, talking to the other children. They just want to mimic everything that you're doing. And the more opportunity you give them to do that without distraction, it's better for the child. Now we're going into year two, which is the time of independent thinking. So this is the period where they'll say, let me do it, right? They want to feed themselves. They want to wash their own hands, right? They almost want to seem like a mini adult. And so why is this happening, right? So basically what's happening at this time is that there's a lot of increase in the area of the brain that's in charge of language. And they're starting to see themselves apart from their parents. And so what's happening is not only do they want to show you that they're independent, they want to tell you that they're independent. But because the speech is just starting to develop, the issue is that a lot of people don't understand them. And they say about 50% of what a 2-year-old says to a stranger is misunderstood. And so what's happening then is that there's tantrums, there's a lot of frustration happening, because here the kid is like, let me do it by myself. And then people are trying to do things for them. They're saying, oh, it's so cute, because they have no idea what the child is even saying. And I've done this before, where you just kind of smile and then they're just like, what's going on with this person, right? And so it's just really frustrating for them. And then they don't know how to handle their emotions, right? And so then oftentimes it leads into a tantrum. How can you help at this point? It's really good to allow them to make decisions, right? Give them a few choices. So I want to give the example of reading a book, right? Prior to maybe age 2, they like sitting in your lap and reading a book. And so a lot of times parents at year 2 will say, okay, I won't start the book until you sit in my lap. But the kid no longer wants to sit in your lap, right? But you're not understanding that. You may think that the child's misbehaving. And so what we suggest is, as long as the kid is safe, they're in the vicinity, continue reading, right? Let them kind of figure out where they want to be, but you can still read. Allow them to take turns and read. Give them an opportunity and ask them if they want to read. Allow them to pick a book. Just allow them to make some decisions in areas of their life where they can. Again, I know they're only 2, so little things that they can actually choose what they want to eat. Like, you give them limited choices. Like, I'm not saying give a whole buffet or anything like that, but like if there's carrots and cucumbers, right? Which one would they like to eat? And that just helps them feel like they're safe in their environment and that they actually are capable of doing things. Year 3 is the thinker, right? This is the phase that people really find hard because they're constantly asking questions. And so it's like, why, right? And this is because there's a growth in the left hemisphere, again, with the language. And so that they're seeing things can happen consistently, but they don't understand why those things are happening. And how you can actually help the child is don't tune them out. I know a lot of times you just want to say, okay, I don't hear it. But as much as you can, try to answer the questions, right? And if you don't know the answer, show them how to get their own answers. So whether that's Google, opening up a dictionary, asking a friend, show them that you don't always have the answers and that's okay, but there's ways to find that out. And we don't need intense explanations at this point because they're not going to understand that. Keep it very simple and try to come from a standpoint of realizing it's not for attention. It's actually, they need those answers. So I don't know if you've ever had those times where you're having a conversation and there's a word that's in your head, but you can't think of what it is. And it'll eat you up until you can figure out what it is. That's exactly what's happening to the child at that age. Year 4 is the dreamer, right? What you're seeing is that there's an imagination explosion. And so this is when they're starting to do pretend play. So they'll say, you be the prince and I'll be the princess. And they really just want to interact and create different scenarios. And why this is happening is because abstract thought is starting to develop. They're starting to understand that things can be a little bit more complicated than they had once imagined. And so it's not just A to B, there's A, B, and C that can happen in a scenario. So they're just really trying to make sense of their environment. And it also allows for them to really understand how other people are feeling, because they'll have to insert, like, you know, a lot of times if you play with your children, they'll be like, well, you feel sad right now. They're trying to tell you what they perceive you would feel at that time. So it's a great way to kind of correct if you feel like, no, you know, I wouldn't be sad. I'd actually be happy at this time. It's just to help them encourage those social interactions. So the best way to help them at this time is actually play with them. And if they don't want to play with you, that's okay, because typically we find that they want to play with siblings or people their own age. But if they actually do want you to come in and play, the best thing you can do is play with them. Year 5 is about the schmoozer, right? So they're wanting to please others, and this is the phase where they really want to help, right? Sometimes I know it can be annoying because it may not be the safest time for them to be helping, like when you're cooking, but they're really just they're starting to understand that they can actually be part of somebody else's world, right? And they're starting to understand that praise and attention feels good. So they want to do things that will get them that attention. And so it's constantly about, like, how can I help? Because I want to increase that feeling of feeling good about myself. So again, how to help at this stage is to reinforce that positive behavior. Tell them you appreciate it. Really emphasize how that makes the other person feel. So like if they're trying to help you, say, I feel happy when you help mama with dinner, right? Just rather than saying, oh, great, you want to help with dinner, let them know how you feel about it, because that actually holds more meaning to them than doing the behavior in itself. It's that attention that they're getting. Year 6 is really about empathizing, right? They're starting to gain new perspective. And this is when they're starting to understand. You can say to them, do you know how your sister may feel? Do you know how your friend may feel? So they're starting to get out of their head and realize what I feel is not necessarily what the other person feels. And so they're going to want to maybe do things for other people based on what they like. It's no longer, oh, I love chocolate cake, so let's get my sister chocolate cake. It's more about my sister loves chocolate cake, so let's get her some chocolate cake. And why that's happening is, again, because the frontal lobes are starting to increase in development. So year by year, the frontal lobe will form bits and pieces, but it won't fully develop until you're 25. And so there's emotions happening around judgment. They don't want to be taken in a negative light. They really want people to see them positively. So how do you help them at this point is you actually encourage them, reinforce this habit, you validate this new perspective, right? Yes, your sister would love chocolate cake. Let's go get her some. It's also a really important at this period of time to introduce them to activities, especially creative activities. So what studies have found is that if you introduce 20 minutes of musical instruction a day, it can actually alter the brain in terms of developing better language and learning skills. So anything that really taps into the creative sector is the best to implement around this time. Year 7 is about being the comedian, right? This is when they actually realize that they can be funny and the jokes are no longer about just farts. They actually know phonetically, like, where do you pause, right? Where do you actually do an intonation? Where do you say, okay, wait for it, and then they give you a pause before the pun. And this is happening because they're starting to understand that jokes don't need to be literal, right? They can be made up. And so that's why their jokes are starting to become funnier. The best way to help kids at this stage is to show your silly side, right? Show them that being creative, telling jokes is okay. And it actually will help them again in social encounters if that side of them is encouraged. Year 8 is about copycatting, right? It's known as the downsizer. And what's happening at age 8 is the brain's starting to prune. So what's essentially happening is, like, there's so many connections in the brain when we're born. And as we get older, they start to snip them and make them quicker. Because if you have so many connections, imagine like it's a pool with 500 fish, right? They can swim in any which direction. But when there's less fish, there's a lot less places for people to get confused, right? So a fish doesn't have to avoid the other 400 fish. And so what's essentially happening is that it's having to prune down so that the messages can be relayed a lot faster. And what's happening at this time, because that's happening, they're starting to become more self-aware and they're starting to compare themselves to other people. So a lot of times is when parents start to say, you know, my child's saying they don't want to go to the activities anymore. They're starting to put themselves down and saying, well, I'm not good enough. This is actually happening because of that pruning process. And it's just because they're now becoming more self-aware and they're understanding strengths and weaknesses. How to help? Giving false hope actually backfires, because what's happening is that you're creating a false world for them. On the inside, they know they're not doing a good job, right? Essentially at whatever activity it is. And then they're getting this message about, no, you are doing great. And so it makes them feel worse. It's like, why is it not feeling good for me? So we want to help them and say realistically, okay, maybe this is not the sport for you. Maybe this is not the activity for you. And that's okay. Let's find something that does work for you. And it's so important at this point to find something that they are good at, because the theory that before, back in the day, it was okay, yeah, just expose them to failure, it'll make them stronger. It actually does more harm for them in the long run than actually making them what, you know, they would say is a stronger person. Year 9 is the one they start to tell lies. Essentially, they're not necessarily doing it on purpose, but what's happening is that they're starting to want to assert even more control. And so with that control comes the lying, right? And they want to see how other people react to that. And so as bad as it may seem, we're talking about little lies here and there, it can be helpful for them to practice how to anticipate people's reactions. Now, we don't want them to be lying about bigger things, but it is part of them kind of finding their way. And how you can actually help them is that you want to talk to them more, but you don't want to be kind of like a police detective, right? It's about kind of preparing some times where you can talk, but making your questions more meaningful. So asking them like, who did you sit with at the lunch table? Or what did you play at recess? Because a lot of times what happens when you ask them those kind of questions is that they start to give you more information rather than just saying, how was your day at school? Because it's a big question and you don't always understand how to answer that. When you ask more specific questions, you get a lot more information. And it's perfect at that time where they'll say, oh, you know, at recess, Molly was really mean to Tim. And then it's your perfect time to insert, how do you think that Molly was feeling? What could Molly have done, right? So you're not necessarily telling them how to live, but you're giving them perspective. And that's the best way to actually address issues of bullying that will typically happen around this age as well, and kind of support their growth in terms of what they need. Year 10 is about the explorer, right? So now they're starting to realize there's in and out groups. They're developing these schemas, which are pretty much boxes that will tell you these kids are cool, these kids are not cool. Now, just because they've developed these schemas, again, the frontal cortex isn't developed, they don't necessarily realize that those boxes may not be true, right? Just because you get placed in one doesn't mean you have to be that way. So they just think if you're in the box, you're cool. If you're not in the box, you're not cool. So how to really help your children at this point is that show them that they can be part of more than one group, right? It's not just the kids in class. It can be your sports friends. It can be kids in the neighborhood. And again, you just want to get them involved in different activities and different play groups so that they can start to see that we can all play together and not essentially have to be in these boxes. Now I'm going to get a little bit more into anxiety and depression and understanding these factors. And what I really want to kind of hone in on is that anxiety, depression are not all or nothing, right? They can vary in intensity and they can vary in presentation. So what one kid may be experiencing anxiety may be seen as an anger outburst in another child. So there's very different ways of presenting. And so it's just important to be open-minded and not kind of label the child and say, oh, well, they're not anxious because they're not showing this pattern of behavior. So sadness and anxiety, like I said earlier, are normal feelings. They become problematic when they become more of like a frenemy. It kind of lingers. It's there all the time or most of the time, and it stops you from doing things. So it's like that frenemy that you don't really want to be friends with, but they're around and you don't know what to do about them. That's when it starts to become a problem, when it's overtaking your day, where it's really essentially kind of maybe you're avoiding school, you're avoiding going to activities, you're no longer interested in the activities that you used to be interested in. So it's much more of a greater effect than just maybe for a moment saying, you know what, I'm sad. My friend didn't want to play with me. And then like 20 minutes later, the kid is out playing again, right? That's a very different presentation as the kid doesn't want to play with anyone anymore or is avoiding going to school. So again, it's more than the norm. And so when we are looking at anxiety, what is it that we're actually seeing? So anxiety, again, is a normal part of childhood and every child goes through this. It only becomes an illness when it becomes about avoiding places and activities. And what you're seeing is, I won't go through all of them. I think you guys will get a copy of the slides, but it's this agitation, this restlessness. They may show physical signs of like being tense or complaining of stomach aches. They can say they feel nauseous. They're very sensitive to criticism. They want to avoid new situations, or they have trouble actually adjusting to new situations. They may not do activities because they're putting it off because they don't feel like they're good enough at it. It may be disturbed sleeping in terms of they're sleeping a lot or they're sleeping less. They're not able to focus, and they're just kind of playing out the same thought over and over again. Depression, again, like I said, sadness and depression are different. Sadness is a momentary experience that you feel in the moment. It doesn't linger on for days. And so when it's persistent and it starts to affect the way you feel, think, and behave, that's when it becomes more of an issue. And that's when it becomes more diagnosable. Again, what you're noticing at this time is sadness. It may be irritability. A lot of times, actually, for kids, it's more agitation and irritability more than anything else. There may be temper tantrums, there's withdrawal, school performance may change. And again, they may start eating more or less, or they might be sleeping more or less. So in the therapy room, and what research typically shows that for anxiety and depression, a lot of it is somatic because they don't have the language like we discussed earlier to kind of say what they're feeling. A lot of it gets sent through in terms of the body. So they may complain of stomach pain. They're feeling sick, right? They're having headaches. Headaches is a big one, like migraines and things like that. Like we're seeing a lot more in kids, and it's not necessarily environmental. Like people are saying, oh, like they're eating food that's unhealthy. Maybe that's why. It is a lot coming from the stress aspect of it, is that they're not understanding what they're experiencing. And so the body is translating that into somatic symptoms. Behavioral level, you're seeing a lot of anger. Anger is probably one of the number one things that we see. The withdrawal, the avoidance, wanting more attention in terms of reassurance that I am a good person. I'm not a lonely person that nobody wants to care about. It's more that I actually belong, but that never sticks because it will be momentary. And so that's why they need more and more assurance, because that fact just doesn't stick with them at the time. So common misconceptions about mental health concerns in children is, what could kids be sad about, right? The more we talk about it, the sadness or fear may get bigger, which absolutely isn't true. It'll actually get worse if you don't talk about it. They're doing it for attention, manipulation. It was an old school thought that they do it for attention, but rarely do we see that it is for attention. There is, on some level, hurt, and they just don't know how to maybe talk about it. And so it's coming up in terms of anxiety and depression because it's going unchecked or unspoken about. And so a lot of times it isn't about the attention or the manipulation. It's a new generation problem. We were fine as kids. Again, not true. Sink or swim, you know, if you just throw them in, they'll toughen it up. They'll toughen up. But we talked about earlier that if you do that, it can actually hinder their self-confidence more than helping them. It's just a phase, and it just happened, right? Mental health concerns don't just happen, they actually build over time.
Or deep depression. The film Inside Out depicts a young girl struggling with a traumatic experience of moving home. This movie very accurately describes why people get anxious in this world and why we need to be allowed to be upset and uncomfortable, even in public sometimes. In a scene from Inside Out, Riley has a situation where she is called on to talk about her life. She feels okay remembering her old feelings until she reaches the point where she realizes that her happy life that she knows of is gone. In that moment, she needs to embrace sadness to help cleanse that moment. But instead, because of happiness struggling with sadness, she gets caught in place where those feelings remain unresolved.
We used to play tag and stuff. Cool Kids was praying at 3 o'clock. No.
Did you see that look? They're judging us!
Somebody help me! Grab...
Joy, no! That's a core memory!
Stop it!
Wait!
It is never nice to have to cry in public, but sometimes when we experience a traumatic event, we need to get upset, scream, cry, or whatever to reach closure on that situation. As a result of not getting closure, Riley becomes jaded and scared to talk to anyone, in fear of having to experience the uncomfortable feeling of being emotional and upset in public again. Therefore, many people who suffer from anxiety, and particularly social anxiety, find themselves in this kind of trap, trying to avoid those feelings again and again, and so they get anxious. In order to release the panic, the person needs to heal that trauma. They need to feel okay with being themselves, no matter how vulnerable that is. Once we have time to grieve and we feel supported, it is easier to again embrace happy thoughts.
Riley can't be done with me.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this.
We can get over feeling sad quite rapidly once we are allowed to gain a resolution to our pain. Never try to hide your feelings when they surface. They are essential to our well-being to be experienced.
You took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time. We had breakfast twice that day.
Sadness!
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
How did you do that?
I don't know.
Wait, you gotta fix this. Get up there. Sadness.
It's up to you.
Me?
Sadness? Sadness?
I can't, Joy.
Yes, you can. Riley needs you.
Joy finally recognizes that sadness cannot be avoided. Sadness is an essential part of the healing process. Once Joy realizes this, she allows sadness to affect the core memories so that finally Riley can let out her emotions and in doing so start to rebuild who she is and how she feels about things. If we try to be happy all the time and not allow ourselves to get upset ever, then it keeps us trapped. So this is definitely something that we need to do.
sharing this clip because it
In
really hones it in for parents and children to really understand why we need to experience different emotions, right? It might be uncomfortable, but if we don't allow the child to feel that, they always kind of associate that feeling as being something negative, and it really alters their perception of how they can experience it later in life. And so, you know, a lot of times I get the question, is it nature, is it nurture, right? And I do say both, and I really feel like this kind of helps explain this graph does, right? And so if you think about your child and the idea of nature versus nurture as the foundation of a house, and then the foundation is actually your nature, and the house in itself is your nurture. So say you have very strong foundation, right? And you have a house that's built on top of that. Everything's going great. What happens when an earthquake happens, right? It shakes the foundation. And if a foundation is not strong at that point because of what's happened in nature, then the individual starts to change at the same time. The house can't be as strong. And so what we really need to do is that, yes, there is this element of genetics, and it does make a big difference in individuals. But if that person doesn't have the right nurturing, the right environment, it can pretty much negate what the genetics have given them. And what research has shown is that between the ages like of 2 and 10, that's when the brain can actually change the most. And because it's so susceptible, especially at age 2, that it's very important during these early periods in the life to help that kid develop the skills, the safety, the tools to manage their experiences so that the brain can actually develop properly. And what this amount of effort that required the change pretty much tells you is that it requires a lot more effort when you start moving past 10, right? So at earlier ages, children can change and it doesn't take as much effort, but if it goes unchecked, it becomes a lot harder to make those changes later in life. So now that we know, here it is, right? The child has an issue. What do you do now? As we saw in the video, denying the experience actually does a lot more harm. Tell them that you see what they're saying, right? I see you're scared. Not, you shouldn't be scared. It's just fine. Is let them know that you're hearing what they say. This is the essential piece of what happens in therapy, is that they feel heard. And a lot of times kids come in and say, Mom and Dad just don't understand, right? Because we want to make it better for them, but that's not necessarily what they need. Acknowledge the presence, right? Don't say that you're going to take away the problem for them, but let them know you're here and you're willing to hear them out and support them how they need. Remember, it's about the child, not you, because a lot of times it can be hard. You're like, what did I do wrong? Did I do something? And they don't, and even if you don't tell the child that, they can recognize that if you're not fully present. So just kind of keeping it back. Every child's different, right? You may have done the best that you can, but the child still has a concern. It's not about the guilt. It's about understanding what they need and what you can do moving forward. Don't make anxiety or depression or the concern the enemy, right? Let them know it is a concern, it's there, and we can work on it. If you make it negative, then the way that they experience that later on in life, again, will be in a negative terminology or in a negative light. Don't use a lot of words, right? When a child is in panic or they're really sad, they essentially are not hearing much. It's kind of like really like blah, blah, blah. And this is just kind of a link that explains what happens when your brain is in a heightened stance. So the best thing to use is nonverbal language, a hug, holding their hand, right? Just kind of sitting next to them is so much more validating and helpful than actually saying anything at that time. Educate the child about their experiences during times of ease, right? So talk to them when they're not in a period of where they're just crying. Wait till they stop crying, wait till the anxiety maybe passes, and then talk to them, because that at that point they can take in more information and they'll be more susceptible to what you're saying. Coming up with coping cards, especially for younger kids, sometimes they don't know how to access the coping skills, right? So a lot of times what I'll do with kids is that we'll come up with cards and we'll put down breathing, like blow. We'll put little symbols that help them remember. And I tell parents, look, when they see a bit of a trigger coming, right, hold up the cards or put the cards out where they can see, so they can start to see what skills can be used. Externalize it, right? Drawing is a great way to talk about feelings, especially for kids, right? I have kids like who will use black and they draw all over the board. It's a great way when they don't have the language to say what they're feeling to actually be able to put it in a story or to draw it out so it doesn't feel like it's a part of them. Because a lot of times when we see it on paper, we can talk about it better than it being stuck in our head. Do an investigative game, right? That can be fun to try to figure out, you know, what triggered this, right? What was it that was happening the day that made me maybe feel a little upset, right? And so you can make it a fun game in order to not make it feel so intense for the child. And there's no rush to do this. It could take days, it could take weeks, and that's okay. But doing it together consistently is what we want to aim for. Build a safe space, right? It may be a playroom, it may be their bedroom, it may be just like a blanket that's hung over a chair, a place that they can go to when they're feeling overwhelmed and they know that's kind of their space. You want to make sure that you don't always just give attention to the anxiety and depression per se, but also to the non-distress behavior, right? The things that they're doing in their life, because sometimes it can be really easy to hone in on the anxiety and depression, but then that's what becomes of the child. All they see themselves as is the anxiety and depression. And so you want to start to emphasize other parts of their day, like their social lives, things that, you know, maybe kind of get consumed by the anxiety and depression, and kind of move away and talk about those things rather than just the anxiety and depression themselves. Exposure and response prevention. This is the whole idea of not throwing a kid into the deep end. You actually want to slowly introduce something that the child may be scared of, right? So say that the child may be scared of play dates, right? Or going to a mall. What you would essentially do is to start to label what are the parts of that movement, that sequence of events that causes the most anxiety and what causes the least. Maybe getting in the car causes a level 3 anxiety. Maybe getting to the signs of where the mall is causes a level 6, all the way up until actually getting down out of the car, which is at level 10. And once you kind of have that down, right, you rate all the different areas of the sequence that are causing anxiety or sadness, you can start to slowly expose the child to that. Now, this is what we do in therapy when children, parents have tried, you know, doing lesser things at home and they've seen that it's not helping. We take it to the next level, but you can do simple exposure at home, depending on what the issue is, like fear of spiders or like not wanting to go to sleep, or there's a monster under the bed, right? And you can give them tokens at each milestone for having accomplished that. And again, it may take a few days, it may take weeks. You're not typically saying days, it's more like a couple of weeks before you can actually move on to the next step. So you don't want to force it. You don't want to make the child feel bad about not being able to do it. And they may move back and forth in that sequence, and that's completely okay. So I know I went over a lot of information, and I'm sorry if I went really fast. I just wanted you guys to have as much information as possible. You know your child best, right? The best thing I feel like is if you feel like there may be a concern, talk to your child. A lot of parents are scared to talk to them because they're like, well, we don't want to give it attention. But a lot of times they can kind of tell you that something doesn't feel right. So between the two of you, you can often tell that something may not be attainable at home and that you need consultation, right? And just because you seek consultation doesn't mean they have to get therapy, but at least you've touched base with someone in the community that can give you a little bit more of an objective view on what's happening inside the home, right? And again, it's not to say that you're doing something wrong, but it's just to understand, is the child actually suffering from something bigger than a typical emotion? So I am done with my presentation, so I will take on any questions.
Okay, thank you so much, Dr. Neda. Our Q&A is open, and so anybody can enter any questions there. While we're still kind of thinking about all that great information that you gave us, I did come up with a few of my questions. They're never brilliant, but maybe it'll just kind of prime the pump a little bit. I have heard that it's helpful for children to gain language in order to describe or define their emotions, so they're not just saying sad, happy, mad. Is that something that you've found useful so that they can talk about with more complexity?
Yes. And so what happens is a lot of times when we come in for therapy, we assess, do they even have that language, right? Because part of therapy could be about giving them the tools and that language to actually express what they are saying. Now there's kids, obviously we can't work against what's where their development is. So there are play therapists, right, who can work with children through play and kind of incorporating aspects. So they, again, it may not be language that they're telling you, but they can tell you through play, and that's acceptable given the age level that they're at. But it is a huge piece that we do work on for age appropriate, is to give them that language, because without that language, it's hard for them to be understood and kind of really get the complexity of. So as the kids get older, we want to make sure that that foundation is there.
Okay, great. And again, just allowing people a few more minutes to formulate their thoughts and questions. If a parent or a caregiver suspected that their child might be being bullied, in a friendship group or at school, what are some ways that would be helpful for them to kind of get to the bottom of that or uncover it?
So I know a lot of times parents get protective, right? They want to take away the situation. And given, yes, there are certain situations that are absolutely that you need to step in, right? When it becomes physical and things like this, but it's a learning moment, right? And what you really want to do with your child is talk to them and not necessarily go in with solutions, but explore, right? What do you think? And take it away. Like if they're involved in it, kind of put their friend in that situation rather than putting them. Because a lot of times kids won't come and say at older ages that I'm being bullied. They might say, oh, my friend's being bullied. And it becomes about someone else, because it's hard for them to identify themselves as the victim or the person being bullied, because then that means that something's wrong with me. And so it's more about communicating with your child what they feel. And then if maybe some bigger steps need to be taken, is to keep the child in the loop. And, parents will say, well, my kid will hate me if I go to the principal. Well, if that's something that needs to be done, it's better to tell the child that you're going to do it, but don't make that your first step unless the behavior is very problematic and it is an issue of safety.
Okay. Someone is asking, they say, I know this is likely best answered on a case-by-case basis, but do you have any tips for parents to know when to help push their child through a tough situation? For example, going to a birthday party without mom, or when to give them support?
Yes. So some of this is about experimenting, right? Is that you drop off a child and the child doesn't regulate after about 20 minutes, right? So you want to give them about like 20 or 30 minutes to try and calm down. If that's just not happening, the kid is in hyper mode, it actually will do some, not like a one-time thing, like when you drop them off at school, it takes them a while to kind of adjust to that, is that they've now started equating like this situation is not safe. And if they don't calm down the whole time, you've now understood that this is a bigger issue that needs to be addressed in a smaller sequence rather than letting them wait it out. So if you drop it first 2-3 times, you're noticing this is happening consistently, that's where you want to start stepping in and seeing maybe there is a bigger issue at hand. But again, it's an experimental phase, right? So you may have to do it 2-3 times before you recognize that it is a problem. That 1-2-3 times is not going to damage your child, don't worry, because it's like I showed you the diagram, is that they recover very quickly at this age.
Okay. Again, just giving people a few more minutes. Oh, here we go. Someone's saying, what if the child is only having the behaviors at school, whereas they're calm at home? How can parents support the child and the school?
So this is actually something that we hear a lot of, is that there may be social anxiety, right? So at home is typically the safe place, the place where, they can take out their frustrations, and they know, like, if they say something, they're not going to be shunned. Mom and dad are not going to throw us out of the house. So it can be a lot more pressure when they're at school. And so it doesn't mean that they're not experiencing anxiety or depression. It means that they just feel safer and then it's not coming out at home. But it is, if it's coming to the point where the kid can't focus, grades are being affected, right? It could be social anxiety. There could be a learning disability, right? They may have ADHD. Testing may need to be involved. So it's important to recognize that if they're drastic enough, well, I shouldn't say this if teachers are kind of making reports, because sometimes, unfortunately, there are a lot of kids in the system that teachers may not pick up on the behaviors, is that if you're seeing changes in terms of the child seems continuously exhausted when they're coming home from school, they're shutting down and they're just locking themselves away for the entire day, not wanting to talk. If, again, grades are being affected, they're not wanting to stay back for activities that they used to enjoy. Again, these are probably concerns that need to be discussed maybe with a professional.
Okay, great. There's another question here that says, first, they say thank you, and this is very helpful. They say, I believe I saw an earlier slide that said that anxiety is a phase in children. Could you clarify that?
Oh yes, that was actually the misconceptions that anxiety is just a phase, it'll go away on its own. And so that was the old school thinking of like, let them sit with it, it'll be fine. But that's actually not true. It can intensify. And now again, it's not black and white. There are certain situations that, you know, they'll get over it. But if it's true anxiety, like we said, where it's persistent, it doesn't just go away on its own.
Right. And it seems like the tricky part is knowing when it's just an emotion. We all have emotions. And when it's something that needs to be addressed, maybe get some outside help, maybe try and work with it more with your child.
Exactly. And I say the biggest key is when it stops a child from doing something, that's when you know it's a bigger problem than just kind of being like, I'm a little anxious about like going to a birthday party. And then once they're there, they're fine. It's more about it will now deter them from going at all.
Okay, that's helpful. Thank you. Right. So if you have other questions, or if you feel like maybe your question wasn't quite answered, or you've got a follow-up question, please go ahead and put that in the Q&A. I checked the chat as well. So we'll give people just another minute here. Another thing you talked about is overcoming avoidance with like that slow exposure. We're seeing so many kids concerned about school and getting back into school. Maybe just as we wrap things up, any tips about addressing those kinds of issues about anxiety around school, since we're seeing so much of that?
So I'm going to try to answer this generally because it depends on the age group again. But, you know, for younger kids, a lot of times I talk about a safety object, right? And so for kids, we have told parents to get a bear, right? That may wear a scarf that represents mom. Like, it's about understanding what makes them feel safe and trying to incorporate that within their environment so that they can start to get comfortable, right? If it's severe anxiety where they're not attending school at all, I know some schools will work with you where, you know, you're going in for half a day. They allow you to check in, call mom during midday to let them know how they're doing, have lunch with the parents, kind of breaking up the day. But it really depends on finding a safety aspect. And sometimes, you know, medication needs to be introduced when the anxiety is so high. And if I'm absolutely terrified of going to school because in my mind, I'm going to be bullied, my life will be over, I need something to cut the edge off. If you're telling me to go to school, it's like life or death at that point, right? And to us, it may seem dramatic, but that's actually what they're experiencing. And so for short term, maybe medication is needed to kind of cut that edge off where they can see like, okay, like I can breathe, I can go to school, and then they can start to incorporate some of the changes that they're working either on therapy or with their parents. So there is an element of medication that may need to be addressed before the therapeutic skills may take effect.
Okay, thank you. It looks like we do have one follow-up question, which is, it's a great one to end with. Someone's asking about how do you go about finding a good therapist? So maybe you can talk a little bit about that generally, and then perhaps go into Grow Collective, since that's where you're from.
Yes. So this is essentially the biggest piece, right? And sometimes it may take a few different therapists, unfortunately, right, to understand which one might be a good fit. And I always emphasize at the every start of my session is that we can't be best fits for everyone, right? And so about 70 to 80% of the therapeutic efficacy is in the relationship, right? We all do different types of therapies, and it can be very hard to decipher what's CBT, what's psychoanalytic, what's EMDR. It's a lot for someone who doesn't necessarily know that much about therapy. Is essentially that relationship needs to be there. I need to feel comfortable to be vulnerable in front of you. And so that's what you're really looking for, is that when you go in, so a lot of times I will speak for myself, I do parent intakes with kids who are under 10, right? And the parents can kind of tell personality wise, will that child fit it? If they are not sure, they'll say, okay, let the kids see me once or twice and let them see how they feel. And typically kids are very vocal about people they don't like. And sometimes they may just not like anyone, and they need some more time to warm up to them. But it's really about kind of where you feel would match the child's personality, right? Some people need more direct. Some people need a little bit less indirect. Some people need play therapy and they don't have the language. And so it's pretty much kind of a bit of a game of not guessing, but kind of seeing what would be the best fit in terms of a puzzle. But we typically, even at Grow, we have like 10-minute consultations where you can call us up. We talk to you about our style. And that's typically the best way to go about it, is to call the office. On our website, we have a vast amount of therapists that work from different approaches. They work with different age groups. I incorporate sports into my therapy. And so it's there is enough information that will tell you, look, can there be a connection? And that's more what you want to look for, rather than seeing like, how old is this person? How much experience that you have? Because I know a lot of times people can look at, oh, you've only been out of school for 2 years. It doesn't matter. It's more about that relationship that we're looking for.
Okay, thank you. And we keep ruminating on this and forming questions. Someone's asking for resources, maybe books, podcasts, articles, et cetera, especially for that 6 to 11-year-old range that you found helpful for parents. Person may already be working with a professional, but we, of course, as parents want more insight. So any suggestions that you might have there?
So what I can do with that is, like, I have a different tab where, like a document that I have more of that information about what resources may be good. So what I can do is ask the other therapists as well, especially some of the play therapists for the younger groups, about what resources they use. And then I can send that over to you, and maybe you can make that available on the website or somewhere within the page.
Sure. What happens at the end of our programs is we'll send out some links, some follow-up links to connect with you and Grow Collective in an email following tonight's program. If you are watching the recording of this program and would like those links, you can just email me at ce@wheatonlibrary.org. That's CE for community engagement at wheatonlibrary.org. And you had mentioned, perhaps slides or these additional resources. We don't probably need to send that out to everybody. So you could just reply to that email that I send you and ask for those specific things that you would like in the way of follow-up. I think we'll probably do it that way. Okay, sounds great. All right, well, there's just lots of gratitude and appreciation in the chat here. So thank you so much, Nita, for our time together and all of your wonderful expertise. And we'll say thank you for joining us tonight, everybody. We hope you got some answers and some more insight into those great little ones that are in your care. And we will see you again soon. Good night.
Good night. Thank you.